All right. Something on there. Hello, hello. I don't have my glasses on. I can't see the TV. How's everybody doing? We will be getting started in about 5 minutes. All right, what is going on? How are we doing, Andrea? Are we all studying for the NCLEX or in nursing school, or are we already nurses and we just, want to do a little more practice? What is up? Ashley, what's going on? Christina, how you doing? What's going on tonight? What is that? Is that? Bella, NCLEX in 2 weeks. You got this. You got this. Good. Chilling for a shift at 6 a.m. I don't envy you. I don't have to go to work until Wednesday. Andrea, she's studying for her PN. Okay, awesome, guys. Love that. While we have just a couple minutes, if you guys are interested, you're studying for the NCLEX, maybe I'm completely new to you. I do offer custom NCLEX study plans. All right, you can get the custom NCLEX study plan through the link in my bio. Yep, they're $25. I get them back to you in 1 to 2 days, but essentially it takes all the guesswork out of what to study each day. All right, it's tailored to you, your weaknesses. Each one's customized. All right, Cardi B's fan took my... What was that? No, but that's all right. Good vibes. Good vibes for Cardi B fan. All right. But yes, if you have not taken your NCLEX already, I do offer custom NCLEX study plans. All right. I actually just posted a video on it like 30 minutes ago. Yeah. So, okay. So you're not yet able to get your quick results yet, I take it, judging by the crying emoji face. It's all right. Just try not to think about it. Easier said than done, right? Go do something fun. Am so done studying, Christina says. Yes. And, dude, once you pass, it is just like, just weight off your shoulders. How long maximum should I study for the NCLEX? I mean, it depends, man. I usually would want at least a few weeks, some people study for 2 months, 3 months. I say 6 weeks is a good time frame. Not everybody has that much time, and that's fine. But maybe, is that what you meant as far as to study for the whole test, or how much you should study each day? All right. Vanessa in here dropping little cheat codes. Let's just say Cardi B says a lot of case studies with no med math. Just know that only 3 of those case studies actually count to your score. Okay. Sometimes people have up to 5, but they are usually just testing other case studies and using you as the guinea pig. Lucky you. All right. But really only 3 of those case studies count towards your score. Okay. How long are you qualified? As far as when you get your RN, how long until you have to renew? It's 2 years. You got all 150. That means whatever the decision was, the NCLEX came to, it means you were very close. It means you were very, very close. Yep. I took the NCLEX twice. Loved it so much I wanted to take it one more time. But yeah, I did not have a plan the first time. Cassandra says, took mine Saturday the 10th and had passed results the following Monday. Cassandra, let's go. Everybody drop some love for Cassandra in the chat. Just passed her NCLEX. Fantastic. My mind is mentally. Yeah, you gotta just, hey, you're gonna just go in, sit down. It's like, I plan on taking 150. If it shuts off at 85, good on me. All right. But don't get disheartened if it doesn't stop at 85. All right. Just keep on going. All right. Keep on going. That's right. Okay. All right. Booty's case studies. Few select all that apply. Yep. Mm-hmm. Yeah, guys. So, as Cassandra dropped, I would say that's a huge win. Anybody else take the NCLEX recently and get past results? Drop it in the chat right now. All right, this is your moment. Let's call you out. All right, if this is you, I want to celebrate people. And again, if you guys are studying for the NCLEX, you can check out the link in my bio. All right. Or if you want information on what the study plan entails, you can go to this video.
For the NCLEX, a lot of people don't need more resources. They need structure.
Okay.
My study plans are built around your real life schedule. Okay, your week content areas. You'll get a clear routine.
All right. This walks you through what the study plan is, how to access it, going through the link in my bio. All right. And then a few people who commented, who would send me DMs that they passed. Okay. So that is available to you guys. All right. So I did just receive one person in the last 10 minutes. Got a study plan. So I promise you guys it's $25, but hey, the cost of retaking the NCLEX is like over another 200. So check it out. All right. All right. What are the questions? Petra and my friend. No way, Petra passed. That's amazing. Petra also was a recipient of a study plan. Cardi B. Petra got it. So Petra passed. That's awesome. I actually just saw her in my DMs. I was scrolling through just a few minutes ago and was like, oh, I should check in to see how she's doing. That's awesome. So glad to see that. And Shazlin said, I just subscribed to your study plan. My name is Shazlin. Awesome. All right. Well, I'll be getting that back to you in a day or two. All right. I look forward to working on it. Thank you guys for sharing the live. How about we get into some study questions? Okay. So we are going to be doing a mixture of cardiac and lab values. All right. Cardiac and various types of lab values. All right. So we're going to get that off the screen there. And Nat says, I'm using Archer. Yeah, Archer's good, man. You can pass with any of them. Archer, Bootcamp, UWorld, whatever. It's more so how you study and how you make the most of that resource. All right. And that's what my custom study plan does. All right. But let's get into some questions here. All right. Of course, we'll have rationales and stuff, but we'll try to keep this moving, okay? I've got 40 questions prepared. And I did just upload some new TikTok Live recordings to my YT, okay? To my YT, Nurse Jimmy Official over there, all right? So I think there's like 18 plus of these long form recordings posted over there for you guys to watch. All right. So feel free to subscribe over there as well. All right. Yeah, guys, which new lab value requires the nurse's immediate follow-up? Let's start this with an important lab and hopefully a gimme here, right? So yeah, guys, it is absolutely going to be potassium, okay? All right, because potassium of 3.1 is low. Duh, right? 3.5 to 5, yep, Maria knows it. And it's a high-risk dysrhythmia trigger. So especially with diuretic therapy, the presence of PVCs, muscle cramps, weakness, all of those things are compatible with hypokalemia. All right, so let's keep it moving. Keep this train on the tracks. All right. All right. We're getting our gimmies out of the way early, okay? All right. Yeah, guys. Potassium again here, okay? I promise there won't be that many potassium answers. So yeah, potassium 6.2. Well, we know, again, 3.5 to 5 is our normal. And in this question, we're seeing peak T waves. That is a classic high-risk ECG change that can rapidly progress to a lethal dysrhythmia. All right, absolutely. Good job. Okay. All right, here we go. A nurse caring for a client with AFib on a heparin infusion for a newly diagnosed pulmonary embolism. Client's gums begin to bleed. All right. The provider's not in the unit and the nurse reviews the most recent labs. Which lab value requires the nurse's immediate follow-up? Which lab value? All right, I'm seeing a few kind of all over. It looks like we're coming to more of a consensus of A, and that's going to be the correct answer here, guys. That's going to be the correct answer. So 100 APTT of 112 seconds. So that is markedly prolonged. Okay, the range is what? Does anybody know the range? Does anybody know the range of the APTT? What's the therapeutic range without Googling it? All right. It is 60 to 80. Okay, APTT is 60 to 80. Close, Shazlin, show, close. All right, 60 to 80 seconds, depending on protocol, okay? They've got active bleeding going on, plus signs suggest that there might be some excessive anticoagulation and high hemorrhage risk, right? Those bleeding gums. So we need immediate intervention. So we need to hold that infusion, right? We need to hold that infusion. Okay. Okay, Jackie says, I was thinking INR. Now, INR is typically, I think, like 0.8 to 1.2 with a target range of like 2 to 3. Okay? All right. And that was 3. Let's jump to 4. Let's go, guys. And guys, if you haven't already, I would love and appreciate you if you would be so kind as to share this live and repost it so that we can get a few more people in here. We did, now it seems like a long time ago, had an attendance record of 1,100 people in my live. It was crazy. Hold on. I think I just saw somebody say, Fizzy Silver just says, hey, Nurse Jimmy, I passed my NCLEX. I watched you religiously before my exam. Dude, that makes me so happy. All right, everybody drop some love there for Fizzy Silver. Obviously dropping a little endorsement here of these lives. Awesome, dude. So happy for you. Took some of your advice. Fantastic, man. Happy for you. Fizzy Silver, RN, has entered the chat. That's right. Hell yeah. Okay. Thanks for sharing some love for our friend Fizzy Silver. Okay. So, what do we think here, guys? I'm seeing some A's. All right, which lab value requires the nurse's immediate follow-up. All right. Okay. So yes, answer is A, digoxin 2.6. So that is elevated. Typical therapeutic range for digoxin is 0.5 to 2. All right. You often lower targets when we're talking about patients in heart failure. All right. And the client has classic toxicity cues like GI symptoms, visual changes, bradycardia. All right. So yeah, they have a risk for dysrhythmia for sure. And we need to address that. That definitely requires immediate follow-up. Good job, guys. Good. All right, question number 5. Let's keep it rolling. Keep on rolling. Keep on rolling. Let's go. Here we go. All right, guys. Which action should the nurse take first? Okay. Yeah, we are definitely should have read that question and be like, okay, this is an unstable patient, which means I either need to assess or intervene. And then think to yourself, Jimmy, do I need any more data? Do I need any more objective data for this patient? No. So I'm going to intervene. Okay, right. I need to intervene. So I need to look for an answer that reflects an intervention. Okay? And then which intervention is most appropriate. All right. Thank you for the follows, my friends. Thank you for the follows. We do these lives 3 times a week, Sunday, Tuesday, Thursday at 9 p.m. Eastern. So if you haven't already followed, you can follow up here. All right. So question 5, guys, the answer is going to be B. We are going to stop that nitro infusion and maintain IV access, right? Because the client has acute hypotension on a vasodilator infusion. Okay, so continuing the nitro can worsen perfusion and precipitate shock. So all bad vibes, we don't like that. We're going to cut that shit out. Okay, so don't do that. Don't continue the infusion. Definitely stop it. All right. Let's go to 6. Here we go. Shazlin. Woo, let's go. Okay, a nurse is reviewing morning labs. All right. Tingling around the mouth, muscle spasm in the hands, and we are seeing on the telemetry prolonged QT interval. All right. Which value requires the nurse's immediate follow-up? Okay. Some of you are saying A, but what is the lab value? What's the normal range for calcium? Does anybody know without hopping on to Mr. Google? Okay. Yeah. 8 to 10, 8.5 to 10.5. Yeah. 9 to 11. I've heard that as well. I always equated calcium to, I think, the terrorist attack of 9/11. I don't know. That's how my brain connected it. So yeah, 9 to 11 was what I used. Yeah. All right. So yeah, hella calcium is low. So the answer is A. All right. Answer is definitely A. All right. So that can cause that perioral tingling, right? Tetany-like spasms, QT prolongation, all right, which matches the symptoms in the telemetry mentioned in the question, right? So this increases dysrhythmia risk and needs prompt correction like right now, okay? Niche, what niche? I've been on your lives a lot. Just wanted to say I passed the NCLEX January 14th. Niche. Oh, dude. Drop some love for Niche in the chat. Hell yes. Niche. Love it. Love to hear it. Thanks for coming on and sharing that with us. Maybe just hang out for a little bit, you know, just do a couple questions with the people. I know you're a big RN now, all right, but you're not, too big to come back and learn something. All right, buddy. Hey, congrats. That's amazing. Good freaking job, man. All right, so let's go to 7. LPN. Oh, sorry. LPN niche says I would definitely stay. Fantastic. Appreciate the support, and I'm glad I could play a very, very small role in your journey to becoming a nurse. Awesome. All right. So, guys, we have a nurse caring for a client with new onset AFib. They have orders for warfarin. How will we know if it's working safely? Okay. Which lab is going to be most important to trend for safe warfarin therapy? This should be a gimme, right? This should be a gimme, guys. But it's in there. It's in this question set because it is very important. When you understand when you hear anything talking about warfarin, you absolutely need to know about the INR. Okay. Option A. All right. So INR is the standard lab used to monitor and dose adjust warfarin. Okay. Basically, it reflects the anticoagulant effect and the bleeding risk. So again, some of you were a little confused when we did the heparin question because the APTT is for heparin. INR is for warfarin. Okay, so platelets matter for bleeding risk generally, but they don't guide warfarin dosing. All right, so I think pretty much everyone got that. Yep, A is the answer there. INR, good job. Sean V, thanks for the follow. Sash, thanks for the follow. Guys, if you're not already following, I would suggest it. Okay, we do these lives 3 times a week, Sunday, Tuesday, Thursday, 9 p.m. Eastern. All right. Usually 2 of these lives are this, where we do as many questions as we can get through in an hour. The Tuesday live is more of a question strategy breakdown with a bunch of examples. Okay, so as you can see, if you've been hanging out for the last few minutes, there are people chiming in saying, hey man, I watched you religiously and ended up passing the NCLEX. So time well spent. Okay, what do we think our answer is here, guys? All right, which lab value requires the nurse's immediate follow-up? All right. Yes. Okay. Interesting. I saw a bunch of right answers and then I saw a bunch of wrong answers, and I was going to be like, yeah, good job, guys. And then it's like, ooh. Oh, you guys. Okay. Yeah. So the answer here is going to be B. So those of you who put B in the chat, okay, give me some clock it fingers. All right. Yep. Good job. So B of BNP of 1450. All right. So we'll talk about it. Okay. So basically that very elevated BNP supports acute decompensated heart failure. So that's what we are testing for when we test a BNP. If it's elevated, it's usually a symptom of heart failure, okay, which matches like the new crackles, worsening dyspnea. Those are all signs of fluid overload, all right? Troponin rise matters for MI, trending, okay? But the immediate clinical change in the respiratory compromise from likely some sort of cardiogenic congestion, that thing needs prompt intervention, okay? So that is why the BNP is the answer there. All right. All right. So yeah, your normal BNP is going to be usually like below 100. Okay. All right. Makes sense. Thank you guys for all the follows. All right. Which days do you stream? Chris said Sunday, Tuesday, Thursday. All right, Sunday, Tuesday, Thursday, 9 p.m. Eastern. BMP is basically just giving you, clinicians use it to determine essentially if somebody has signs of heart failure. Okay, it's usually that coupled with some physical symptoms. Yes, BMP was the answer. BMP was the answer. Okie dokie, artichoke. So, the telemetry shows frequent PVCs and flattened T waves with prominent U waves. Love our ECG questions. Which lab value is most consistent with the telemetry findings and requires follow-up? Let me look in the chat here. So, all right, I'll catch up next time. 2 a.m., Chris. Where? You must you must be European. Stop it, Jimmy. Stop it. Okay. All right. Question 9. What are we seeing? I'm seeing a bunch of A's. All right. Anything else? Yep. Looks like there's a few people saying B. The correct answer here, guys, is going to be A. All right. The magnesium of 1.3. Okay. While I explain this, go ahead, if you know it, drop the normal range for magnesium in the chat so everybody can see. All right. So magnesium 1.3 is low. All right. And it can contribute to that ventricular ectopy. All right. And abnormal repolarization patterns. Okay. Yeah, 1.5 to 2, 1.7, 2.2, something around there. All right, but yeah, 1.3 is low. Vomiting causes electrolyte losses, okay, while U waves classically point to hypokalemia. But the option set makes magnesium the best match to the rhythm instability that it talks about, okay? So yeah, some of you put B for potassium, but that potassium level is normal, okay? 3.5 to 5, again, is our potassium range. That sodium level is normal. So yeah, there's not a whole lot. The calcium level is normal. I think the chloride level is normal. All right, guys, good job on that. Let's jump into 10. Let's see what we got on 10 here. All right, thank you guys for sharing the live. All right. If you guys are just jumping in, about 500 of you in here now. I do these lives 3 times a week, Sunday, Tuesday, Thursday at 9 p.m. Eastern time. So if you're not already following, you can go ahead and follow up here. All right. And then on the main part of my profile page, there's a bell in the top right corner of my page where you can set notifications to only be alerted when I go live. If that's something that interests you, I'd love to have you in, okay? Love to have you in. So let's jump into question 10 here. We're talking about another heart failure patient, prescribed spironolactone. Client says, I'll keep using my salt substitute since I'm cutting back on my sodium. Which teaching is most important? Okay? Which teaching is most important? What are we saying here? I see some B's. All right. Yep. All right. Bella says A. Some others are basically saying B. The correct answer here is B. All right. We want to tell this patient, we want to teach them, okay? We want to teach them to avoid salt substitutes, okay, that contain potassium while taking spironolactone, okay? Because spironolactone, we must know, is a potassium-sparing diuretic, like our friend here just said. Maddie Gran RC, that's how I'm going to say it, is potassium sparing. It increases the risk of hyperkalemia. All right, so we need to tell them to avoid that. All right, some of you were saying A. No, A, while, so it's misleading, okay? Because no sodium doesn't mean safe, okay? Potassium content matters. Okay? Potassium content matters here. I don't know that anybody was else. So I think A and B were pretty much the only answers I saw. So we won't go too deep into that one. All right. John, thanks for sharing the live, my friend. Thanks for sharing the live. All right. And thank you for those that are following. All right. So let's talk about this patient coming back from a cardiac cath 2 hours ago after an NSTEMI on a heparin drip. Now they have new low back pain, feels really weak. Oh shit, hypotensive, tachy. Are we assessing, intervening, evaluating, or teaching this patient? What would we, yeah. Well, we're not doing any of this because the answers are just lab values. But if we had a different slew of answers and it was like, which action is the nurse's priority? We would be intervening. If there was an answer that was like, do this shit now, we would do it, okay? Because we need to address this life-threatening issue. But that's not what this question is talking about. This question is talking about which lab value requires the immediate follow-up. All right, so what are we thinking here? All right, I see a few of you saying A, a couple, there's a B. Yeah, guys, the answer here is most certainly going to be A, okay? If you didn't get that, that's okay. This is where you want to get questions wrong, all right? I don't take points off for incorrectness. So, yeah, the hemoglobin of 7 is, and it's saying was 10.2, and now it's 7.6, and now they're hypotensive, tachy. They just had a procedure, so there's likely some sort of like retroperitoneal bleed post-cath, right? So most hospitals, yeah, 3Y3K0NS says infuse if it's under 7. I agree. Most hospitals will give you a blood transfusion if it's under 7. And with a patient like this, it's hypotensive, tachy, they just had a procedure. Yeah, I think the threshold for giving blood would be pretty low. All right. So, this too much. I'm just trying to be a nurse, not trying to be a doctor. Hey, no, but these are the things that we are going to see on the monitor and we're going to see in the chart when labs comes back. And we need to be able to recognize when our patient is about to crash out, right? 12. All right, here we go. Yep, that's right, Gwen. What you in Venus? Are you just agreeing with me? What's what? Morgan, thanks for following. Appreciate you. All right, we're talking about Venus. You always comment on what I'm drinking. You are so interested with what I'm drinking. Yes, Venus, it is a Scotch night tonight, okay? It is a Scotch night tonight, and it's been a couple weeks since there was a Scotch night. Okay? She is so interested in what I'm drinking. What are you drinking, Venus? What are you drinking? All right. Dr. Pepper. All right. Oh, yeah, Jimmy gets down. Mm-hmm. That's my wife in the chat, y'all. Be nice. Behave, y'all. My wife is in the chat, okay? She's moderating this chat, so don't get too crazy, all right? All right, guys. Question 12 here. Yes. For those of you who are answering B, that is correct. All right, we're going to hold the next dose of warfarin and notify the provider of the INR, all right? Because they have active bleeding signs, suspected interaction with the antibiotic. Okay, so the safest first step is to stop the further anticoagulant exposure and escalate for management. Okay? So let's see. Yeah, so there probably needs to be a dose adjustment, maybe even a reversal of the warfarin. Okay. So what else was anybody saying? Let's see. So for answer A, vitamin K may be indicated, but IM administration here is going to increase hematoma risk, and the client should not be sent home without a provider-directed plan. All right. All right. Let's see. Y'all are funny. Y'all are funny today. All right. Does that make sense, guys? All right. Thank you guys for following. Sending someone home is almost never the answer. Absolutely true. All right. 13. Let's do it. All right. A nurse came for a client with AFib on amio. New lightheadedness. Which lab value requires the nurse's immediate follow-up? Oh, you guys should know this. We just had one recently with this. Yes, Queens. Yes. All right. For sure. A is the answer. Because we know, if you've been hanging out with us, we know that the mag level is generally like that 1.5 to 2, 1.7, 2.2, right? So, yeah, we already have a patient that is basically at risk for ventricular dysrhythmias. Okay, so especially in a client with QT prolongation on an antiarrhythmic, yeah, low magnesium could definitely cause torsades, making it basically the most urgent thing going on here. Okay. Haven't been studying lab values because next gen gives ranges. I would say they're good to be familiar with, and generally good to understand the physical manifestations that present in the patient when you are either hypo or hyper, whatever that electrolyte is. Okay. Or whatever that, the INR, the APTT, and then all of your hypo, magnesemia, kalemia, all those things. I think knowing the symptoms is also, Marty says right there, helps you know the why. All right, I feel like it just gives you more confidence going into a question. All right. Ellen's like, what are we studying for, guys? Because I'm rocking it. All right. Yeah, we are drilling some NCLEX questions here for passing your nursing boards. All right. All right, here we go, guys. 14. All right, now we are talking about a patient that's being treated for torsades on IV mag, and now they're awake, calm. Monitor shows fewer ventricular ectopic beats than earlier. Which finding best indicates improvement? What are we thinking? I'm seeing A and B so far in the chat. What are we thinking? Yeah, so this is basically just an inverse of the question that we just had. So they had the ventricular dysrhythmia of torsades. We gave the mag was low, and now we have an answer. Basically evaluating, this would be a good example of a question where the answer is an evaluation, where you are evaluating the effectiveness of an intervention, okay? That's when you pick evaluating type answers. And so here, the answer is going to be A. okay, your MAG increases from 1.3 to 1.9. That is the most correct answer here. All right, so that's going to directly reduce torsades risk and ventricular instability. All right, it's the most objective indicator that the intervention was addressed. Okay? Mama Mac Sauce says, what was the last answer? What, the 13? 13 was MAG of 1.4. All right. Ellen says she's been a nurse for 35 years. 35 years, Ellen? Jesus, that's almost as old as I am. Not to make you feel old or anything. Sandy says, what is torsades? Torsades. It is a funky dysrhythmia. It kind of looks like a form. People get it confused for VTAC, but it basically has these uneven waveforms. Here, let me pop it. I'll show you. It looks like this. Okay. More kind of like this. This is the more traditional, where it has small, big, and it has this just funny wave pattern. Okay. So that's what torsades looks like. Okay. All right. Good. All right. Let's jump into question 16. Quita, this is for both RN and LPN today anyway. There's a lot of overlap here. All right. All right. 16. You got scattered petechiae, bruising around the abdomen. Nurse reviews trending lab values. Which lab value requires the nurse's immediate follow-up? Wait, you're like, wait, did you answer 15? Did you answer 15? No, I'm sorry, I didn't answer 15. Okay, guys. Chill. Oh my God, you skipped one. You skipped one. Okay. Holy moly. Okay. All right. Sorry. Okay. So, which lab value is most important for the nurse to reinforce as a priority to trend after starting lisinopril? All right. So, if you chose serum creatinine, you are correct. Okay. A. All right. Because why? Why, guys? Thanks for the follow, Jess. ACE inhibitors, okay, they can increase your serum creatinine due to how it changes the renal perfusion, especially in somebody with chronic kidney disease. All right, so trending creatinine early helps detect unsafe renal decline and kind of guides any dose adjustments that are needed while still providing that long-term heart failure benefit, okay? Does that make sense? All right. And if you didn't know, your serum creatinine generally is about 0.6 to 1.3. Okay? 0.6 to 1.3. All right. All right. Now we'll go to 16. Holy moly. Okay. All right, guys. Thanks for the follows. Those of you who are following. If you guys haven't already followed and you're just jumping in, maybe you're new, never hopped on my live before, but we do these NCLEX reviews 3 times a week, every Sunday, Tuesday, Thursday at 9 p.m. Eastern. You can follow right there, okay? Would much appreciate it. All right. LaShawn, thanks for the follow. The previous answer was serum creatinine. It was the one you guys all made me go back for. Okay. All right. Let's look at which lab value requires the nurse's immediate follow-up. All right. It is definitely going to be A. All right. Platelets decreasing from 248 to 92. Holy crap, right? That is a platelet drop, okay? So normal platelet range, I know you guys know it, is about 150 to 4, okay? 150 to 4. So they're on heparin, okay? So this is basically suggesting heparin-induced thrombocytopenia, or HIT, H-I-T. All right, so which is paradoxically pro-thrombotic, okay, and can become life-threatening, okay? So it requires immediate escalation, stop the heparin infusion, okay? Are we good there? I don't think we need to go too crazy on that one, but let's talk about HIT a little bit more, all right? The client now reports new chest tightness. Sudden drop in SpO2 on room air. Which action should the nurse take first? Which action should the nurse take first, guys? What should they do? Home Essentials Elite, thank you for the follow. Oh yeah, heparin. Duh. All right. 17 gang. Let's go gang. All right, yes, we are stopping the infusion, okay? If there is a suspected HIT, HIT, heparin-induced thrombocytopenia, continuing the heparin is going to increase thrombosis risk, and we don't want that, right? So the most immediate within nursing control action is to stop the trigger, all right? And that would be stopping the heparin infusion. All right, good job, guys. Good job. 18. How many more can we get through? We got 20 minutes, guys, 20 minutes. Should we go a little bit faster? What are we thinking? Some are like no, some are like yes. Yeah, I need more of a consensus. All right, 18. Yeah, that sodium is hella low, right? Yeah, we're talking about cerebral edema, seizures with the sodium like that, okay? Sodium is normally 135 to 145. So, yeah, we need to correct that-ish, like right now. All right, but not too fast. Sodium is one of those electrolytes that we do not want to rise too fast, or that could make things worse too. Okay? All right. Good job. 19. All right. So now, a little bit, we have our same patient there that's hyponatremic. They have a good IV on seizure precaution, but the provider's not arrived yet. The nurse is to choose the safest immediate action while awaiting orders. What should they do? All right. Well, I'm seeing a lot of A's. And you would be correct, okay? A is going to be the answer here. So during an active seizure, the immediate priority is, of course, airway breathing and injury prevention. All right. Where am I at? I had a patient a couple weeks ago. I was walking down the hall to go into one of my patients' rooms. I was about to on the door, and I hear a loud thud in the bathroom, which is right beside me. And somebody walked by and opened the door, and there's this dude just actively seizing on the bathroom floor. And yeah, the immediate priority is I don't know what he hit on the way down, but I'm there now, and so I'm holding his head. All right, I'm holding his head so he doesn't schwack it on the floor, and then have somebody else grab the suction canister from the crash cart so they can come and just kind of keep that airway clear. All right, so yeah, seizures, airway, breathing, safety. Okay, good job. 20. All right. Hey, Janae, good to see you. All right. What are we thinking? All right. Yep, definitely. It's going to be A. All right. We are definitely going to trim those troponins because what is troponin? Troponin is a cardiac injury biomarker. Okay. So basically, I explain this to patients as troponin is basically what is released in your bloodstream when your heart is under stress. So that's why we're able to test it. And so we test those blood samples, serial blood draws, usually 3 of them, and each one we do an EKG during each blood draw. So absolutely, that's going to be our answer there. All right, let's see. 21. Let me just make this a little smidge smaller. All right. All right, guys. What are we thinking? All right. Which new lab value is most concerning and requires immediate follow-up? All right. We're seeing some of you are thinking that hematocrit. What else is low? Calcium's a little low. All right, but hematocrit was 36. I got a little bit of a white count. BMP is elevated. All right. Yep. So the answer here is going to be A. You guys are on it. All right. So that basically that sharp hematocrit drop after a femoral access with flank discomfort, okay, and dizziness suggests there's some sort of internal bleeding going on. So we need to get that addressed ASAP. Okay. What is BNP? BNP is the name of what the 3 letters stand for escape me right now, but it's a test for heart failure. Okay. Our normal BNP is under 100. All right. So the answer here is A. Okay. Hematocrit. Thank you for the roses. All right. And Lakeisha, thank you for the follow. All right, let's jump into 22. There it is. Suzanne dropped it in there. What BNP stands for. Guadalupe, thank you for the follow. All right, 22. Starting a high-intensity statin. Okay, which lab value should the nurse emphasize? All right, good job, guys. God, you guys are just so damn smart. Yep, absolutely. It's going to be A. Creatinine kinase. 100%. All right, so CK can rise with statin-associated myopathy and rhabdomyolysis. So especially when muscle pain is going to be severe, or accompanied by weakness or dark urine. All right, the CK is usually between like 220 and 200. Helps quantify muscle breakdown risk and guides any urgent evaluations. Okay, so 23. All right, and then we're gonna jump to some other answers here, to some other questions. All right. We'll do like 2 or 3 more questions, guys, and then we'll chat a little bit here, okay? Just briefly, just go over a couple things. So stay put if you're still in here, okay? All right, 23. What are we thinking? All right, so the question is, which lab trend is most concerning and requires immediate follow-up? All right. Yes, the answer is, again, A. All right, I did not pick which letters were the correct answers here, okay? So apologies that there are too many A answers, okay? But, yeah, don't let that throw you off on the actual NCLEX, okay? It's like, why are all these... Why are all these answers B? Okay, I don't know, man. Okay. Yeah. So troponin increased from a baseline of 0.08 to 0.32. All right. So even when the baseline trope is chronically elevated, usually in chronic kidney disease, a significant rise, right, plus new ECG changes and diaphoresis is definitely concerning for some sort of MI or some sort of, MI injury, myocardial injury. All right. What else can we say about that? So the trend and clinical picture matter more than the troponin is always high. Okay. All right. Let's see here. All right, let's jump to some of the other questions in the back here. Let's look at 32. All right. Amir, you want to meet the people? You want to meet the people? You want to meet the people? Say hi to the people. You're going to get way more people in this chat, aren't you, girl? This is Ellie. Say hi, Ellie. Are you going to tell the people what the answer is? She's like, I'm going to tell you that the answer is B. Okay? The answer is B. If you got it. If you got it, pat yourself on the back. Ellie says, pat yourself on the back. So yes, the answer is B. All right, because those thiazide diuretics increase urine output. Okay? All right. Hold on, let me move this in there. Okay. So yeah, there's thiazide diuretics increase urine output. Okay. Nighttime dosing increases nocturia and fall risk. Okay. Especially in older adults. Okay. So those morning doses support adherence and safety. Okay. All right. Sit. All right. So let's do one more here. And let's look at 37. All right. Here we go. What was it? I think Ellie wants to go outside. She's like scratching at the door. Sit. Yeah, she's a good girl. All right. What are we thinking here, guys? A nurse is assessing a client with suspected infective endocarditis. The client has a history of IV drug use and reports fever and fatigue. The nurse notes new petechiae on the palate and a new heart murmur. Which lab result most supports the suspected diagnosis and requires immediate follow-up? All right, I'm seeing D, some B. Yeah, guys. Okay, all right, a nurse is assessing a client with suspected infective endocarditis. Okay? That should rule out, I feel like, 3 of them. Okay? I feel like I would be like, okay, maybe now I'm between A and B. All right? Because I'm thinking something about infections. Okay? So what the correct answer, though, is B. Okay? The correct answer is B. Positive blood cultures drawn from 2 separate sites. Why? I will tell you why. All right, so multiple site positive blood cultures, all right, are central to diagnosing endocarditis. All right, and they are going to guide the targeted antibiotic therapy. All right, so leukocytosis is supportive but non-specific. The culture result is the most actionable and time sensitive for definitive treatment. All right, so blood cultures is definitely the thing that needs addressed here. All right, so A, I think I just said, so the elevated white blood cell count supports infection but doesn't identify the organism, right? C is not diagnostic and not the priority. D is not specific for endocarditis. And E is a chronic control marker, all right, unrelated to the acute diagnosis. All right, so you guys, great job tonight. Do you know if I have to retake the LVN program? I do not know off the top of my head. All right, check with your nursing board. Good job. All right, I'm going to stick on for just a few more minutes. If you guys want to follow, again, you can follow up here. I do these lives 3 times a week, Sunday, Tuesday, Thursday at 9 p.m. Eastern. The topics so Tuesday is a question strategy. And also we'll be doing some fundamentals like leadership and delegation. And then again, some question strategy on how to break down some of these NCLEX questions. And then on Thursday will be a mix of med surg and infection control. Okay, so look forward to that. All right, while I still have a couple of you here, I know, are any of you taking the NCLEX soon, interested in a study plan? Nadia says, thank you for your study guide also. You're absolutely welcome. Nadia got a custom study plan. Drop your name in the chat here. Yep, Ava. Okay, so
yeah,
let me go through real quick. All right, guys. Crail, check this out. This is what I want you guys to do. All right, when we get off here, you can do it right after this. Okay, you can go to my profile page. All right, click on the link right there in my bio. All right, it's going to take you here. Okay. Then Wisland, Tabitha, all right, go to get a custom NCLEX study plan. You click that link, okay? And then from there, all you do is just real easy, fill out your information. What NCLEX are you taking? Is this your first time, okay? If it is, cool. All right, if it's not, I do want some information about your CPR. What categories were you above the passing standard? And what categories were you below the passing standard? Okay. Yeah, what does the study plan look like? Any examples? Yeah, I can show you an example. When's your test date? What resources do you currently have access to? All right, because this is what guides when I tell you to do like a 75 question set of mixed questions. I'm going to tell you utilize whatever resource you say that you have access to. All right. What subjects do you feel, oh, I know I'm weak in maternity, peds, and fundamentals. All right, great. How much study time do you have access, or do you have each weekday? So I'm looking for a single number. Like, hey, I've got 3 hours on the weekdays, or 8 hours on the weekdays, and 2 hours on the weekends. All right, and then click each day that you're available to study. Okay, each day that you're available to study, and then also you can tell me about how bad your testing anxiety is. And then here is a spot for you to be as specific as possible. All right, literally anything else that you have going on in your life, your learning style, things you've tried, things that haven't worked. All right, let me know. All right, and then you just pay down here. It's your $25. Okay, yeah, it's a lot cheaper than retaking the NCLEX. All right. Let me bring the camera back onto me, and I'll find an example of a study plan here. Okay, so all right. So this is generally what it looks like. This one, they usually come out to be about 7 to 8 pages. All right, it starts out with a note from me. All right, and then it goes into talking about this person's CPR, and we go through the whole process, which I explain in the plan about tagging missed questions, all right, by domain, all right, how to set up your miss log and rule book, all right, steps for how to increase your active recall. And then here's the bulk of it. Okay. This is your daily structure. This is based on everything that you tell me over here as far as the time that you have available. All right. I build out this plan, blocks of time that tells, okay, utilizing whatever study resource you tell me you have access to, that's what I'm going to reference here. Okay. I'm going to tell you the subjects to look for. All right. And these are based on your resources. Some folks, if you don't have any resources, I'll usually suggest the nurses' labs mixed quizzes there. All right. For this person, we did a Thursday deep session. All right. And so it literally breaks it down week by week, day by day. It gives you a weekday routine and a weekend routine, and how to focus your time and what subjects to focus on. This person only had availability to study on Mondays and Thursdays. All right. Again, this is based on their CPR because they are a repeat tester. All right. So these were some places that they were below the passing standard on their CPR. So that's why the plan was built around those weaknesses. Okay. So talks about their resources, how to use them, and then what's the timeline to test day. All right. So we have our test date in here, and then what are our goals for the first 10, 20, 30, 40 days. Okay. All right, so the questionnaire is found. You go to the link in my bio, all right, and then get a custom NCLEX study plan, okay, and then you just fill out the form, okay. Unfinished.steph, you got that? So that's where you find it, okay. Looks like I answered most of the questions there. Okay, good. Okay, so that's what it looks like. That's it, guys. All right, it gives you your roadmap, and it allows you to utilize your resources to to their capacity, to the best of their ability. If you use Archer, Boot Camp, Simple Nursing, UWorld, whatever, this study plan is going to help you make the most out of that resource. All right. Do you recommend any programs over the others for repeat test takers? Again, I think anybody can pass with any of the resources if you have the right plan. I can't really say like one is better than the other. I have only really personally used UWorld because that's what I used when I passed. That was a few years ago. I know they have the reviews I get and hear about, they have a really good question bank with good detailed questions and rationales. Some others are better at tracking your progress, so I think honestly, what would be a good idea if you use like ChatGPT or something like that, whatever AI of your choice, and go on there and just say like, hey, this is my situation. I want to compare some NCLEX prep resources, and then maybe have it like ask you 5 or 10 questions about what you're trying to do and what you feel like you would be better at, and like how you learn, and then have that ChatGPT or whatever make a recommendation on what service or platform feels best fits what you're looking for. That might be something I would do. Okay? All right, guys. Give you another 20 seconds. If you haven't already, you can go ahead and follow. Again, we do these lives every three times a week, Sunday, Tuesday, Thursday. Rima, you're late. That's okay. Thanks for joining. Rima is another one who sent me a DM recently that she passed the NCLEX. Yay, Rima, and passed with my study plan as well. So kudos to her. All right, guys. Well, that is it. Thank you guys for joining. I will see you guys on Tuesday? Yeah, Tuesday. All right. Until then, bye, guys.